What does deaf community mean to you? Unity and solidarity. Personal growth. A place you can escape to.
An invisible world that most people don't even realize exists. But it's there. Once you're there, it's a beautiful world.
Strength and diversity.
Understanding and identity.
Family and close relationships. I work at the National Center for Deaf Health Research, NCDHR. NCDHR is located at the University of Rochester School of Medicine and Dentistry. NCDHR is one of 26 prevention research centers, PRCs, that are funded by the Centers for Disease Control and Prevention, the CDC. NCDHR is the only PRC that focuses on the deaf community.
Typically, deaf people have been oppressed and not involved with decision-making processes around their community. Deaf people are now able to have an equal part in these processes and have ownership by working together. There are interpreters involved to ensure communication needs are met for everybody. It's like a flower blooming.
Historically, public health research and programs are not accessible for the deaf community. NCDHR works together with communities to develop public health research, surveys, programs, and clinical trials that match the needs of the deaf community.
NCDHR has asked the deaf community for their input regarding a health survey they were developing. Translating English to ASL is not an easy task. We bring together a range of older and younger ASL users to discuss the translation process. The discussion leads to a final translation that everyone is able to understand.
We developed an ASL video-based survey that was called the Deaf Health Survey, DHS. This allows deaf people to have access to research, learn about their community, and finally have research evidence to show the community's needs. The Rochester deaf community used the data from the survey to identify health priorities. Obesity was one of them. We wanted to address the community's concerns about obesity. This led us to develop a program called Deaf WeightWise, DWW. We explored different programs that were developed for hearing participants. We found one from the UNC PRC and adapted that program to fit deaf ASL users. Deaf WeightWise is a clinical trial that consists of a 16-week program. It is a deaf-centered program with deaf counselors and deaf participants. I learned so much. I learned how to count my calories. I learned how to exercise, and how to balance my food and my life. A total of 104 deaf people joined Deaf WeightWise. After Deaf WeightWise concluded, participants saw improvements in eating and exercise habits. Participants had significant weight loss and were able to keep the weight off. I lost about 30 pounds, and I kept off 25 pounds. Deaf WeightWise was a success, but the community wanted more. This led to the development of Deaf WeightWise 2.0. This time, the age range for participants was 21 to 70. We added the use of social media and apps to fit the need of the younger participants. We know that the group intervention was successful, but we want to know if Deaf WeightWise can be successful with a one-on-one video phone approach. Our goal is to continue to include the deaf community in our research to achieve health equity for our community.